Guys, today let's discuss about gastritis. Gastritis is one of the disorders that affect the stomach. So, what do we mean by gastritis? So, sometimes you get your stomach being painful. Sometimes when you eat, it's very painful. Sometimes you can have nausea, you can vomit, sometimes blood, sometimes there is indigestion. You feel like and your stomach is full all the time, and it also has symptoms like belching. So gastritis is a very common disease, and I will start by defining what we mean by gastritis. And the word gastritis comes from the word gastric, which means the stomach. So the inflammation of the stomach mucosa or of the gastric mucosa is what we call gastritis. The inflammation of the gastric mucosa is what we call what? Gastritis. And what do we mean by inflammation? Inflammation is a localized, so it has to be localized physical condition whereby that part of the body becomes reddened, swollen, hot, and sometimes very painful. So if someone maybe knocks you with a hammer, so that part becomes red hot and swollen, it's very painful. So that's what we mean by inflammation. So the inflammation of the stomach may be caused by several factors, including non-steroidal anti-inflammatory drugs. It may be also be caused by autoimmune diseases. It may be caused by infection by Helicobacter pylori. That's the H. pylori of the stomach. So sometimes people who take excess alcohol, they can experience this disease. So we have two types of gastritis. Number one is chronic gastritis. Number two is acute gastritis. So when we say acute gastritis, that means it's gastritis that occurs for a very short period of time and goes away. But chronic gastritis is the type of gastritis that lasts for a longer period of time. So, acute gastritis is characterized by inflammation of superficial layers of mucous membrane, and sometimes it is infiltrated with leukocytes such as neutrophils. While chronic gastritis is characterized by inflammation of even deeper layers of the gastric mucosa with infiltration of more lymphocytes, and this results in atrophy of the gastric mucosa. So, what do we mean by atrophy of the gastric mucosa? This means that it's the wasting away of the gastric mucosa, whereby even the chief cells and the parietal cells of the gastric glands becomes eroded, or they become lost as a result. So these will have effects like reduced HCl, that is hydrochloric acid, in the stomach, because the parietal cells are responsible for the production or for the secretion of HCl. So if the parietal cells becomes lost or eroded as a result of this chronic inflammation, so that means we have less and less hydrochloric acid being produced. Together also with vitamin B12, the absorption will be affected. So why are the vitamin B12 affected, absorption affected? This is because you remember we said the parietal cells are also involved in secretion of the intrinsic factor. So the intrinsic factors will be produced less. That means the vitamin B12 will be produced less and less. And this also will lead to the production of red blood cells in the bone marrow being affected. So because the absorption of vitamin B12 has also been affected, and this will lead to a disease called megaloblastic anemia or pernicious anemia, whereby the red blood cells are affected and they do not mature properly, and some of them becomes oversized. So we said some of the causes of acute gastritis are infection by the H. pylori. We also said excess consumption of alcohol may cause acute gastritis. Excess administration or taking of NSAIDs, that is, non-steroidal anti-inflammatory drugs such as aspirin, and also trauma may cause also this acute gastric no gastritis no may cause this acute gastritis. So next, I think we will see the causes of chronic gastritis. This chronic gastritis may be caused by long-term infection by the H. pylori, long-term taking of alcohol, and long-term use of NSAIDs, drugs, that is non-steroidal anti-inflammatory drugs. Also, autoimmune diseases may cause this chronic gastritis. So what are the symptoms or features of gastritis? Now, gastritis features or symptoms are non-specific. Now, common features of this are abdominal upset, so and pain felt as a diffused burning sensation. So when your stomach feels like it's burning, so that's one of the features of gastritis. So this pain is often referred to as epigastric pain. It's normally referred to as epigastric pain. So other features include nausea, you feel like vomiting, and also vomiting will be a symptom. Anorexia is simply means loss of appetite, indigestion, that is your digestion system fails to digest food. So most of the time you feel that your stomach is full. So discomfort or feeling fullness in the epigastric region. So also you may feel like belching, that's the process of relieving swallowed air that has accumulated in the stomach. So if you have erosive gastritis, you might experience different symptoms, including black and tarry stool. So that means blood has been digested and it goes to form a stool that is black. You may vomit blood or stomach contents that look like coffee. So what are the treatments of gastritis? So gastritis can be treated depending on the cause of the condition. If it is caused by H. pylori, that means you need antibiotics. And if it's caused by NSAIDs, that means you have to stop using NSAIDs. So you have to avoid them. And if it is caused by other conditions, your doctor will prescribe appropriate drugs. So let's discuss about proton pump inhibitors. Is one of the drugs that can be used to treat gastritis. So proton pump inhibitors, these are medications that block the proton pump by blocking cells that create stomach acid. So sometimes these are called H2 blockers. So examples of the proton pump inhibitors include omeprazole. So many people know that when they have a problem with ulcers, they take omeprazole. So omeprazole is one type of proton pump inhibitor. So, however, long-term use of these medications, especially in high doses, may lead to increased risk of spine, hip, and wrist fractures. So, because it hampers the absorption of calcium, and now it can also lead to increased risk to renal failure. So often speak to your doctor when you start using these proton pump inhibitors. Now, according